Hello, thank you for watching the video. This is YouTube Medical University. I'll discuss early diabetes symptoms you should know about, and also explain in an easy to understand way from a doctor's perspective how to notice them even earlier. Diabetes is called the silent disease. In the early stages, diabetes has almost no symptoms, and by the time it progresses, you may have trouble seeing, your feet may become numb, and in the worst case, you could get an infection and have to have your foot amputated. And it can damage your kidneys, making dialysis necessary, which means spending 3 to 4 hours a day, 3 times a week. You may end up having to spend that time in the hospital. At YouTube Medical University, we share videos to help you get healthier tomorrow and live vibrantly in your later years. Please subscribe to the channel if you'd like. This time, I'll discuss the earliest signs of diabetes to help you spot it sooner, the symptoms, and the symptoms that appear as it progresses. And also, from the perspective of a doctor who regularly treats diabetes, I would like to explain the methods I recommend for detecting diabetes-related complications early, even before any symptoms appear. If you watch this video until the end, you will not only learn about the symptoms of diabetes, but also understand the reasons why these symptoms occur. I think it's easier to remember if you understand the logic behind it, so let's enjoy learning together. Now, here is today's agenda. In the first period, we'll cover the basic mechanisms of diabetes, and in the second period, we'll talk about what happens when blood sugar levels are high. In the third period, we'll cover 3 main symptoms. In the fourth, 2 long-term symptoms. And in the fifth, dangerous symptoms as diabetes worsens. And in the fifth period, I'll explain a life hack for early detection of diabetes. Now, let's start by learning about the basic mechanism of diabetes in the first period. If you want to know the symptoms right away, please start watching from the second period. This is also noted in The Truth and Lies of Health Information taught by 425 specialists, no Todaichi. As stated, diabetes is a disease that is very difficult to detect early. In your 40s, diabetes risk rises quickly, possibly causing symptoms that can prevent you from working or enjoying your later years. Even if you want to, you might not be able to travel or eat delicious food. I've seen patients like that myself. During outpatient visits, some say they might have diabetes due to these symptoms. Few people visit the hospital for that reason, and those who do usually wait until their condition worsens. They visit a doctor due to dry mouth, weight loss, or feeling unwell, and it often turns out that they actually have diabetes. It's well known that diabetes causes high blood sugar, but why does blood sugar increase? To understand this, we need to examine the hormone insulin's function. You need to know about it. Insulin, have you heard of it? It's a hormone that lowers your blood sugar. Because humans spent a long time as hunter-gatherers, there are many hormones that raise blood sugar to help us endure hunger. Adrenaline, corticosteroids, and glucagon, these hormones. These hormones are the ones that raise blood sugar, and humans have many of them. However, because it's only recently that we've had abundant access to food, humans have almost no hormones that lower blood sugar. Insulin is the only hormone that lowers blood sugar. Therefore, if insulin becomes less effective, or if you can't produce insulin in the first place, your blood sugar will suddenly start to rise. This is the reason why people develop diabetes. One of the most common causes of diabetes is obesity. When fat accumulates in the body, it leads to what's called insulin resistance, which means insulin becomes less effective. When doctors tell you to lose weight in the early stages of diabetes, it's to reduce insulin resistance. In other words, to make insulin work more effectively. It's easier to understand when you consider the reason. And because insulin doesn't work well, our bodies try hard to produce more insulin, which ends up exhausting the pancreas, the organ that produces insulin. When the pancreas can no longer produce insulin, that's when things get serious. Your blood sugar level will rise even more. Everyone, the end stage of diabetes is often associated with being overweight. Is it a state of being overweight, or is it a state of being thin? Actually, you end up losing weight. The reason is that while it's true that the hormone insulin lowers blood sugar levels, it moves the sugar in the blood into the cells, where the sugar is used as energy. If insulin isn't produced, you can't use or store energy, so you'll gradually lose weight. In the next session, I'll clearly explain the order in which diabetes symptoms actually appear, along with the reasons why. I want you to check if you have any of the symptoms I'm about to talk about, and make sure not to ignore them if they appear. I wasn't feeling well, but I just ignored it. Many people worsen and eventually reach a point where nothing can be done. This might be a bit long, but I hope you'll take notes and listen until the end. The effects of high blood sugar? 3 symptoms. The first one is dry skin. You might be wondering, is dry skin related to diabetes? Actually, it is. Why does diabetes cause dry skin? It has to do with the balance of sugar in your blood vessels. When there is a lot of sugar dissolved in your blood vessels, the osmotic pressure increases. Consequently, the force pulling water into blood vessels increases. When the moisture from the tissues around the blood vessels is drawn into the blood vessels, the skin becomes dry. That's why people with diabetes often have rough and dry skin. And then something called dry skin dermatitis can occur, causing itching of the skin. Eczema can occur and the skin can become red. These symptoms are also commonly experienced, and people with diabetes often complain of itching as well. In addition to dry skin, when someone develops diabetes, diabetic neuropathy can occur, causing numbness in the hands and feet, and some people may perceive this as itching. There are people like that as well. Also, when the kidneys are damaged by diabetes, a condition called uremia can occur, because the body can't expel waste and toxins through urine. Toxins build up, leading to a condition called uremia. This uremia is also a cause of itching. If your skin feels dry or you notice some itching, can you detect diabetes early in situations like this? Honestly, unless you're someone who studies these things regularly, it's difficult. I hope you'll keep this in the back of your mind. This is the second main symptom of high blood sugar. It's a decrease in immunity. This is well known among medical professionals. People with diabetes are more likely to have infections become severe. To give a familiar example, have you ever noticed that people with diabetes often get athlete's foot? This is also caused by decreased immunity. Athlete's foot is caused by a fungus called tinea. Because immunity against this fungus decreases, people with diabetes are more prone to athlete's foot. As mentioned earlier, with diabetes, the skin becomes dry and itchy, and scratching can damage it, which lowers the skin's barrier function and makes it easier for bacteria to infect the area. Why does diabetes lower your immune system? Actually, when the sugar level in your blood rises, the cells that fight off bacteria, the function of white blood cells, which are responsible for fighting off bacteria, decreases. As a result, your immune system becomes weaker. Your risk of infection increases. If it were just athlete's foot, that would be one thing. But if bacteria enter through the skin, it can cause a skin infection called cellulitis. The skin becomes red and swollen, and even touching it can be painful. If it gets even worse, the infected area can start to rot and surgery may be needed. And in the worst case, amputation may become necessary. As I explained earlier, people with diabetes often have nerve damage that causes numbness and reduced sensation, so even if they get a wound on their foot, they may not feel any pain, and by the time they notice it, the condition has already progressed. So when you take a bath, please make sure to check the soles of your feet for burns or cuts, or signs of athlete's foot. Developing a habit of checking every day might be a good idea. Here is the third symptom caused by high blood sugar levels. Feeling thirsty and needing to use the bathroom are common signs. If you study diabetes, you know thirst is a typical symptom. You might already know this, but why does this happen? If you remember the reason, it's less likely you'll forget. This is also related to osmotic pressure. Our urine is influenced by the osmotic pressure in our blood. Urine is produced by filtering water, much like a coffee filter. And the urine that is first produced in this way, since the urine contains plenty of essential minerals, the kidneys perform a process called reabsorption. In cases like diabetes, when you have diabetes, sugar mixes into the urine. So due to osmotic pressure, the urine retains more water. As a result, the kidneys can't reabsorb enough water. More and more water is excreted as urine. This is called polyuria. As a result, the amount of urine increases, and you end up going to the bathroom more often. Since water is being excreted as urine more and more, you become thirsty. This is why you feel thirsty and have to go to the bathroom more often. Some people find it difficult to sleep because they have to get up to use the bathroom at night. For men, the reason for waking up at night to use the bathroom is it might be because the prostate is enlarged or because of something called an overactive bladder, where the bladder becomes sensitive. Some people visit a urologist for these reasons, but in reality, there are also people who experience these symptoms due to diabetes. There's one thing I want everyone to be careful about here. It's called pet bottle syndrome. This name is inspired by bottled juices, which are soft drinks high in sugar. When you consume these sugary drinks for hydration, your blood sugar rises even more, and as your blood sugar gets higher, more and more water escapes through your urine, making you even thirstier, so you end up drinking more bottled juice. And this kind of vicious cycle continues, causing only your blood sugar to keep rising, and in the worst case, it can even become life-threatening. Because of this, people with diabetes are often advised not to drink bottled juices, or at least to avoid drinking too much if they do. What did you think? Next period, we'll discuss something that often comes up early. I described 3 symptoms of high blood sugar, starting with dry skin. The second was decreased immunity, and the third was increased thirst and more frequent urination. At YouTube Medical University, we responsibly share videos as medical professionals to help you become healthier starting tomorrow. We'd be happy if you could click the subscribe button so you don't miss any new videos. In the third period, I will discuss 2 symptoms that may develop after long-term diabetes. When high blood sugar levels continue, symptoms gradually appear as the blood vessels are slowly damaged. The key point about the symptoms in this third period is that the damage starts from the small blood vessels. Now let's take a look. The symptoms that appear when diabetes continues for a long period of time, there are 2 main ones. The first is this: symptoms in the eyes, inside your eyes. There are very fine blood vessels spread throughout. What you're able to see, light enters your field of vision, passes through the lens and hits the screen-like back part, which is projected onto the retina. This light turns into electrical signals, and the incoming light is projected as a scene inside the brain. The part that serves as this screen, the retina, is covered with extremely fine blood vessels. Since the blood vessels are so thin, even a slight amount of damage to them can easily cause symptoms to appear. It is said that these eye symptoms tend to appear after about 10 years of having diabetes. Many people have no symptoms at first, but as it progresses, they may develop floaters. You may notice black specks or insect-like shapes drifting in your vision, especially against a white wall. Some people experience these kinds of symptoms. At this point, there is often already minor bleeding happening in the retina of your eye, and as the damage to those blood vessels progresses, your vision may deteriorate or suddenly half of your field of vision may disappear. These kinds of symptoms can appear. By the time it gets to this stage, treatment is often difficult. Due to diabetes, to prevent the progression of eye symptoms, it's important to visit an ophthalmologist as early as possible and, if necessary, undergo treatments like laser therapy to keep your eyes from getting worse. That's why when I see patients with diabetes, I always make sure they have their eyes checked by an ophthalmologist at least once a year to maintain their eye health and check for any progression of damage. Here is the second symptom that can occur when diabetes continues for a long time: nerve damage. Nerves are spread throughout our entire body. It is said that the length of our blood vessels could circle the earth twice, and nerves also run throughout the body parallel to all those blood vessels. So, when the tiny blood vessels throughout the body are damaged, the nerves running alongside them, the blood flow to the nerves is also reduced, which leads to nerve damage. I think it's easier to remember if you also understand the reason behind it. So, which nerves are more likely to be affected? It's the ones surrounded by fine blood vessels. The nerves in those areas are the ones that start to get damaged. In other words, the areas farthest from the body, like the fingertips and toes. That's why nerve problems like numbness start to appear. This is one of the complications caused by diabetes. It's considered an early complication, appearing in 5 to 10 years. Specific symptoms include numbness in the hands and fingertips, and in the hands and fingertips, a feeling like always wearing gloves or socks, or as if a thin skin covers them. A dull sensation. Some people also complain of itching or pain. These symptoms usually appear symmetrically in the hands and feet. As sensation dulls, tasks needing fine finger movements become difficult. May become difficult to perform. It can be hard to button clothes. You might not notice burns in the bath, or you might not realize you have blisters from your shoes. Various problems can occur. Don't assume hand numbness is just aging and ignore it. It could be something else. It is a complication caused by diabetes, so please consider seeing a doctor. In the third period, we'll discuss long-term diabetes complications. As to selected symptoms, I explained about eye symptoms and nerve symptoms. In the fourth period, we'll cover dangerous symptoms that occur as diabetes progresses. If you have these kinds of symptoms, I want you to go to the hospital immediately. I will carefully select and introduce 2 of those symptoms. Here are 2 symptoms that appear when diabetes progresses. The first one is weight loss. If you listen to the first lecture, you should understand this well. What kind of hormone is insulin? It's not just a hormone that lowers blood sugar. It moves the nutrients we take in through our mouths from the bloodstream into our cells, stores those nutrients, and is a hormone that allows us to use them inside our cells. So if you can't secrete insulin, you can't store energy and you can't gain weight. And since you can't use the food you eat as energy, your body won't be filled with vitality. Because of that, no matter how much you eat, you can't gain any nutrition, and on the contrary, your appetite keeps decreasing. And as a result, you end up losing weight. Diabetes is a disease that you get because you're overweight. It's a misconception that people with diabetes are overweight, while obesity is a cause of diabetes. But remember that as diabetes progresses, your weight actually decreases. Remember these 2 symptoms of advanced diabetes. The second one is this: the risk of cancer increases. This isn't exactly a symptom, but it's very important, so I'd like to mention it. Do you know the leading cause of death for people with diabetes? Diabetes accelerates arteriosclerosis, clogging blood vessels and causing heart attacks and strokes. I think it's well known that people lose their lives because of these conditions. However, the leading cause of death for people with diabetes is actually malignant tumors. Even if you think, since I have diabetes, I should properly manage my blood pressure and cholesterol to prevent arteriosclerosis, in reality, malignant tumors can still develop. Because of that, many people suddenly experience a rapid decline in their health, so when you develop diabetes, your risk of cancer is also increased. Keep this in mind. Get regular cancer screenings and see your doctor right away if you notice any health changes. This kind of attitude is important. Why does cancer risk increase with diabetes? The exact cause is unknown, but this hypothesis is well known. When you develop diabetes, insulin becomes less effective. Our pancreas works hard to produce more insulin. Consistently high insulin levels in the body like this is said to increase the risk of cancer. If you lose over 1 kilogram per month and your weight keeps decreasing, please be sure to pay attention in situations like this. For example, if you develop pancreatic cancer, your pancreas can suddenly become impaired, causing insulin production to stop abruptly. Your blood sugar levels can spike rapidly. Even though you haven't had an unhealthy diet or overeaten, your blood sugar levels suddenly spike. At times like that, as medical professionals, we sometimes wonder if it could be the onset of pancreatic cancer. Even though you haven't changed your eating habits, you've lost weight and your blood sugar levels have spiked. In these cases, consult a hospital. Also, there's insulin therapy. For those who use insulin injections, there is no data showing that these injections increase the risk of cancer. Never stop using insulin on your own judgment, so please avoid doing that. In the fourth period, we'll discuss complications that arise as diabetes progresses. I introduced the symptoms. The first one is weight loss, and the second is an increased risk of cancer. That's what I said. There's plenty of information online. Most of it is useful, but there are a few pieces of incorrect information as well. At YouTube Medical University, we create easy to understand videos from the perspective of medical professionals responsibly presenting data. Once again, it would really encourage us if you could subscribe to the channel so you don't miss any new videos. In the fifth period, we'll discuss diabetes, which often has no symptoms, and how to detect it early. I'll explain this using this book. What do you think usually makes people with diabetes realize they have the condition? By far, the most common way is through a health checkup. Working adults usually get medical checkups through their company or local government. They attend a yearly checkup and are told their blood sugar is high, and sometimes other values are also high. Most people realize they have diabetes because of these results. So, what values should you pay attention to during a health checkup? It's your blood sugar level and a value called hemoglobin A1C. According to the diagnostic criteria for diabetes, when you haven't eaten and your stomach is empty, they check if your fasting blood sugar is above 126, And also, regardless of whether you've eaten or not, if your random blood sugar level at any given time or your blood sugar 2 hours after taking a 75-gram oral glucose tolerance test is over 200, diabetes is suspected in these cases. It's important to know if the measurement was taken while fasting or after eating during a checkup. Or after eating. These details also matter. And another important value is hemoglobin A1C. It's a value called that. It's kind of hard to say and read, isn't it? But this hemoglobin A1C value is actually simple. It reflects the average blood sugar level over the past 1 to 2 months. So, even if you skip meals the day before your health checkup or eat very healthily for a week, if you've been living unhealthily for the past 1 to 2 months, it's a number you can't fool. Whether this value exceeds 6.5% or not is what determines the diagnosis of diabetes. However, most people are below 6%, so if your value exceeds 6%, it may not be diabetes, but you should be careful. So to summarize, whether your fasting blood sugar is over 126, whether your blood sugar after eating is over 200, and whether your hemoglobin A1C is 6.5% or higher. If 2 out of these 3 apply, you will be diagnosed with diabetes. If only one of these applies, it is called borderline diabetes. If only one applies, don't let your guard down thinking I'm still okay. People like this are considered pre-diabetic. While they don't have diabetes, their ability to process sugar is weakened. This is evidence of that. I hope you'll make an effort to take preventive measures. I also explained in an easy to understand way about the symptoms that can occur when you develop diabetes, including the order in which they appear and the reasons behind them. Since this was a bit long, I'd be happy if you could listen to it several times or review the video as much as you like. And in the comments section, please share the symptoms you've experienced, things you've learned, or things you're planning to try from now on. If you have something similar, please share it in the comments. It could help other viewers.